Let's talk about the science of EPR. In the beginning, back in the 1990s, Dr. Peter Safar and U.S. Army Colonel Ron Bellamy reviewed the Vietnam War casualties data. Catastrophically, they concluded, over 80% of the wounded soldiers lost their life because they didn't have enough time to transport from field or perform critical surgeries. In other words, they ran out of time. This conclusion left them with the question, how do you provide more time for severe trauma victims, so you can transport and/or perform critical surgeries to save their lives? In the search for an answer, they recognized the anecdotal evidence where both people and cattle have been trapped under snow or ice, and survived. Profound hypothermia. Could this be the answer? In EPR's case, profound hypothermia is rapidly cooling the body to 50 degrees Fahrenheit or 10 degrees Celsius. This is done by replacing the blood with EPR's cold flush plus. In this state, the cellular life of the brain, vital organs and body are preserved and do not require any oxygen for 3+ hours. It's important to note, profound hypothermia, until EPR, has not been used to treat patients. It should not be confused with mild hypothermia. Mild hypothermia is currently being used into slow metabolism, to help the healing process of heart attack and surgery patients. In mild hypothermia, the body is only cooled a few degrees, and oxygen is required to sustain life. After critical surgeries are completed, it is time to resuscitate the patient. This is done by re-infusing blood and slowly re-warming the body. In some cases, the heart will restart on its own, or will be restarted by the medical teams. The next step in EPR's research was to conduct large animal studies. The large animals were traumatized under anesthesia. Then, using EPR's methods for profound hypothermia, the animals were preserved for 3+ hours. After which, the animals were then resuscitated and tested for physical, as well as cognitive function. The results for the large animal studies exceeded expectations. After 3+ hours, the animals were successfully resuscitated, with complete cognitive and physical function. The studies have been published in medical journals. This success paved the way for the FDA to approve the use of EPR in human clinical trials. The human clinical trials are being conducted at the Crowley Shock Trauma Center, in Baltimore, Maryland. The U.S. Army Research Command has allocated funds to continue these ongoing clinical trials. There was a slight delay with COVID and a blood shortage. However, the trials are well underway and we expect to complete the trials by March 2023 and submitted to FDA for approval. All subjects of the trial are required to have suffered severe trauma from gunshot or stab wounds, and CPR failed. With the clinical trial results complete, we are anticipating FDA approval for use in trauma centers by the end of April or early May 2023. In the fourth quarter 2023, we anticipate the U.S. trauma centers to be implementing EPR's technologies and procedures.